Health care is a priority for the nation. Americans deserve access to affordable health insurance, yet we're wasting time here and not doing anything to help with the health care crisis in this country today. Fortunately, one of our colleagues, John McCain, has come out this week strongly for a health care plan that would help every American to be insured. He talks about guaranteed access to health insurance, plans that people can own and can afford and keep, plans that they choose for themselves that are not chosen by government. And this is the direction that we need to move. Unfortunately, my Democrat colleagues, at least many of them, don't want everyone to be insured with personal health insurance policies. They'd much rather the government take over the whole health insurance industry and decide for us what type of health plans that we're going to have. The evidence of this is abundant. There are a number of things that Republicans have done to try to improve access to private health insurance. One is to allow people in this country to buy health insurance from anywhere in the country. Right now they're restricted to buy in the state where they live. So a few insurance companies have a monopoly on the business. We've had a Health Care Choice Act that would give Americans a chance to shop anywhere in the country. Yet the Democrats have blocked this bill. And only a couple of weeks ago, we had an amendment to the budget bill that would allow individuals to deduct the cost of health insurance just like businesses did. But I believe every Democrat in the Senate voted against that. To give some kind of fair tax treatment to individuals who are buying health care, they blocked it. Yet they complain about individuals being uninsured. They do everything they can to keep individuals from owning health insurance. Now the Democrats are trying to destroy health savings accounts. It started in the House with a bill that will change the way health savings accounts are set up. The fastest growing way for the uninsured to get insurance are new types of health plans that have health savings accounts and insurance, where people can buy most of their health care with their own dollars or dollars their employers put in this health savings account that's tax-free. It gives them a lot more choices and flexibility, and it takes out, importantly, the cost of third-party administration. Health savings accounts are a way to restructure health insurance plans so that every time we go to the doctor or the hospital, there's not a third-party insurance company filing claims or dealing with billing and running up the cost of administration. We know today that there are more administrative people in a doctor's office and in a hospital than there are health care providers. The reason for that is that every time we use a health care system, there's a third party involved, whether it's private health insurance or Medicaid or Medicare. There's a lot of administrative cost. Health savings accounts not only give people more flexibility, but it begins to take the cost of administration out of health care. It allows an individual to make their own decisions with their doctors or with their pharmacists as to their health care, and they don't need approval from some health insurance company or some government bureaucrat whether they're going to spend this money. Certainly the way health savings account dollars are spent are restricted to real health care, and that's the way it's working. Unfortunately, a company that provides this service of substantiating the way health care dollars are spent have come to Washington and convinced Democrats that we need a third party to determine whether a health savings account spending event can be substantiated or not. This is definitely a special interest provision that the Democrats have bought into, but what it does is it adds the administrative cost back to health savings accounts, takes away the flexibility that we're giving to individuals, and keep in mind that people who are uninsured and people who didn't have insurance before and a number of people who are switching from traditional plans, that we've gone from 1 million people covered by health savings account type of plans to over 6 million in the last few years. The fastest growing type of health care plan, because that's the kind of plan that people want. Let me just read some statistics. And the reason for all this is the Democrats have inserted on the House side in the bill they call the Taxpayer Assistance and Simplification Act provisions that would put an administrative burden on health savings accounts. They're trying to kill health savings accounts so that we'll all end up with government health care. I've already mentioned that we've gone from 1 million people covered by health savings accounts plans in 2005 to over 6 million today. 31% of the people who have these health savings account plans plus insurance were previously uninsured. 84% of health savings account policies in group and individual market provide first dollar coverage for preventive care. So this claim that health savings accounts keep people from seeking preventative care are totally bogus, because the plans are designed that when someone seeks preventative care, diagnostic care, that the insurance pays for it and it does not come out of the health savings account. Health savings account give people better access to the type of health care they want. And we found that it even helps with chronic disease management. If people have access to $1,000 or $2,000 or more a year to use the way that they need for their own health, then they can manage their diabetes or congestive heart failure or other types of illnesses that are often restricted by traditional health insurance. I want to encourage my colleagues who really believe that Americans should have the freedom to own their own health insurance and to not have to go to the government for their health care, to help us preserve and promote and expand health savings accounts for those who want them. And I want to make it clear, health savings accounts are health insurance. They're just health insurance plans that have savings and insurance with them, so that most of health care can be accessed with dollars of patients doing direct business with their physician, with their pharmacist, with the hospital. It will save millions, even billions as a nation in administrative costs. Already Americans have well over $3 billion saved in health savings accounts for future health care needs. This is an idea we need to expand across the country, not to destroy. And I would ask particularly my Democrat colleagues on the Senate side not to take up this provision that the House included that will hurt and probably destroy the whole idea of health savings accounts.